Get to do that. Okay, and I believe I am recording. Let me just make sure. Yes, I am. Okay. So welcome everyone to the Smartsheet form updates training. My name is Jill Scantlin. If we haven't met before, I use she, her pronouns, and I am the Data and Evaluation Advisor at the Office for Community Health and Engagement. You've probably seen maybe my name in some emails, talking about the activity report, asking you for various things or providing various information. So um, I am the person who is managing the activity reporting and has set up that Smartsheet space. And yeah, so I'm the main point of contact. If you ever need anything, I'll provide my email in the chat here, just in case you don't have it already. Um, It's a good one to have. Yeah, you can always reach out if you need anything. So, welcome to this training. I'm hoping it doesn't take the full hour, but I want to leave time for questions at the end. And really, what we're doing today is going over some of the updates to the Smartsheet form. So, if you all recall, a couple months ago, I sent out a survey to all of the grantees that are using Smartsheet, asking for feedback about how's it been going with reporting in Smartsheet, trying to understand in each section what are some areas for improvement and what's working well, what's not really working well. And we took all of your suggestions and convened a group of content or subject matter experts in health system navigation and really decided together like what are some changes that we would like to make to the form, kind of based on your feedback and some challenges or pain points we saw in the form. So I'll describe those changes today. We'll go through them kind of step by step. I'll also go over some changes that you suggested, but we won't be able to implement during this grant cycle, but we will be implementing during the next grant cycle. So there are kind of some larger changes that will take a little bit more time to implement. And so I'll go over those as well. I'm just going to, let's see, looks like one more person to join. And then, all right, so let's get started on the going through the presentation here. I am going to be going like back and forth between the slide deck and then just showing you the changes directly in Smartsheet. So, like I mentioned, the feedback survey, if you did respond to that, thank you so much. We had about 30 people that responded. And really, the point or the objective of that was to get feedback on what is and isn't working well and what can be improved in the activity reporting. So we're always trying to improve the user experience. So that's your experience filling it out, making it easier to fill out, more intuitive, save you some time. And so that's really my goal. With the survey, the feedback survey was to get input in order to improve your experience. And so the other objective was really to then implement that feedback and make those improvements by the end of the first year of the grant period. So it's a 2-year grant cycle. And so um, June 30th, 2026, that's when the first year is ended, which I can't believe the year has already gone by. So by July 1st, these changes will be made. I wanted just to point to some of your responses on how satisfied you were with Smartsheet overall. I think that was one of the first questions that I had asked. And so if you see here, this graph shows that around two-thirds of the respondents, so out of 30 of you that responded, two-thirds said you're either satisfied or very satisfied with the Smartsheet, which I think is great. There was a little chunk around 16 or 17% that said that neither satisfied or unsatisfied, kind of neutral. And then we had a smaller group around 13% that were either dissatisfied or very dissatisfied. And so I think the big picture here is that most of you are pretty satisfied with Smartsheet, but we still have a small group that are it's still not working for them. So there's still improvements to be made. And so that's why we went through this exercise, and that's why we've changed the form. So hopefully these improvements will be welcome, and you'll be excited about them. and it'll really improve, yeah, your experience filling out the Smartsheet. So I will be going through it section by section and then pausing after each section just to see if there's any clarifying questions or comments that you want to make about any of the changes. All right, and apologies, I'm now looking over and admitting somebody, and so now, yep, now they're in the room. Okay, so section two, we're gonna just dive right in here. Section two, if you recall, or if you can think about the different sections in the Smartsheet, the first section, section one, is that basic information section, asking about like the date that the person was assisted and, the county and the language and all of that. Section two is focused on the application assistance. And so whether you're helping someone to apply for OHP or there's a case change, a request for information, or a renewal. So the first change we are going to make, or that we will be implementing, is to reduce missing data, which was kind of the problem that people brought up. We will be making the questions that follow, let's say if you select that you are supporting a member with an OHP application, it then asks you how many individuals are associated on that case. So for a new application, a renewal, or a case change, etc. So now we're going to make those required. So now when you select that you've helped someone with an application or a renewal or a case change, and it then follows up with the question, how many people are associated with that? And instead of it being optional, it's going to be required. And that's really going to reduce, the missing data problem that happens with that one. Let me just bring over, it's probably easier for me just to show you what that actually looks like in the Smartsheet. And so here's section two, and you'll see that completing an OHP application, all of those different application assistance services. So if you are saying, yes, you did help someone with that, and let's say it was submitting an OHP application, you then have this
Just
follow-up question.
sorry to interrupt. Are you trying to show us the form? I'm still seeing the PowerPoint.
Oh, you know what? Thank you. Let me stop sharing. Zoom is kind of funny because gives you so many options for sharing the screen, and I think I chose the wrong one. I think I want to share the entire screen. Okay, thank you for bringing that up. I usually work on Teams, and so when I have to go on Zoom, I'm like, oh gosh, what am I doing here? Can you see the screen now?
Yes.
And then just to check, when I go like this, can you then see the presentation?
Yes, we can.
Ah, that's the one I wanted. Okay, thank you so much for interrupting me. Because I would have kept going and you wouldn't have been able to see what I was doing. Um, okay, yeah, let's start over. So yes, section two about applications. So if you are helping someone with an application, say you help them submit a new application, like before, when you select that, this question pops up. The only change here is now you see that little red star or asterisk. That just means it's required. In the last version, or the version, I guess, that you are currently using right now, this question's not required. And so what would happen is that people would skip it sometimes, and then that would be, you might would then when you're reviewing it, you then have to then tell me to add the number of individuals, or it just goes unanswered. And so it just becomes missing. But that is information we want to know. It's really going to help us understand the number of people, at the end of the day, how many people did you help with enrollment into OHP or help with the other application services. So it's a really important question to answer. And so we made it required. And so it's a small change, but it should help. Um, I'm now going to, sorry, admit a couple more folks into the call, and see if there's anything in the chat here. Okay, you all were just trying to tell me that you couldn't see the screen. And so sorry, I didn't see that. Um, the other change to section two is, and actually this is a change that we've made throughout the form is in this qualitative section here. And so in the version that you have now, it says something like, please share, a success story or a challenge you're experiencing, something like that. Really, that is not what we want in this section, though. We have a form that is for, for the activity reporting leads to fill out once a month. It's the qualitative narrative form, and that's where you can tell us about trends that you're seeing, like maybe some challenges or talking about particular um, cases that were exemplifying some kind of, bright spot or success story. That's something that we would want only once a month. And so in this form, we don't really need to hear about those types of things. It's more about just telling us anything important related to the person you're helping in that moment. And so if you're helping them with an OHP application and there's some kind of additional information you wanted to share about that. So for example, an extenuating circumstance, or like a lot of people, if they select close the loop follow-up, they might want to put in here some information about exactly how they've helped to follow up. It's optional though. You see the red asterisk not there, but we wanted to make it clear that this section is really just to kind of share any important information related to that health system navigation service you provided and not generally about challenges. I think that was a bit confusing about how we had it before. Okay, so hopefully that was clear. I know it was a little bit bumpy because you couldn't see the screen for a minute, but I'm going to pause and see if there's any questions about those two changes I just went over. Okay, yeah, pretty straightforward, I think. So hopefully you feel the same way. Um, Great. Okay, so now let's get into section 3. So that's the health system navigation education topics that you cover. And so for this section, we didn't remove anything, but we did add two different topics based on your feedback. So the first topic, and actually I think it's a little bit easier for me just to go ahead and show it in the form. Um, and they're highlighted here in yellow. So we added a topic on health insurance literacy. And so this really is covering any information that you provide on OHP or the health insurance marketplace. You know, either prior to signing them up for OHP or even after. And so this was added because we got a lot of feedback that often before you sign someone up for OHP, you spend a lot of time just giving some basic information about health insurance and how it works, and maybe even instructing people what paperwork they'll need to gather and put together, what they'll need to show. Or what they'll need to have in place in order to get access to OHP. There's a lot of things that happen prior to signing someone up for OHP, and so I think a lot of you felt there wasn't really a topic here that covered that, and so we wanted to add that so that so that you're able to capture that education that you're providing. An important note is, we want to distinguish this from just the general outreach that you might be doing with community members. So, say you're at an event, you have a table, you're talking about OHP, and you're just sort of giving information, but it doesn't really lead to someone signing up for OHP. That's really more outreach, and that's not really what we want to capture here. This is really primarily meant for when someone has come into your organization or your clinic, or you're working with them to get them access to OHP, but then you do have maybe a lot of time that you're working with them prior to actually signing them up, and you're providing all of this information. And so that's really the when you should be documenting this. So hopefully that is a welcome change and will help to capture some of the work that previously you weren't able to capture. Another topic is that we added is on open card. And so as many of you are aware, We will have the Healthier Oregon population be transitioning to open card fairly in a couple of months. And so they're depending on who you're serving, you might have a lot of your members and your clients having a lot of questions about that. And so we wanted to add the topic here to specifically track that to see, how much time and how often are you really providing that education, since it will be something that will be changing and probably coming up more often. So I'm just going to pause and see if is there any questions about these two education, health system navigation education topics that we've added. Okay. If there are any questions at any point, feel free to come off mute or to add something in the chat. I will hopefully see it. Or raise your hand. That's another option as well. So let's keep going. And I know there's some folks that have just joined, so welcome. Alrighty. So now we're in section 4, which is the CCO navigation section. Um, and so there's a couple of changes that we made to this section. And again, I think I might stick with just showing you in Smartsheet because it's a little bit easier. So the first change we made is that we added one navigation service called CCO enrollment changes. And so really this is pertaining to when you're supporting members to change the subplan within their CCO. So for example, Health Share in Multnomah County, there's I think 3 different subplans within Health Share. I think there's probably some other CCOs in different regions that have a similar setup where there are sub plans within the CCO. And so this is, distinct and different from changing the primary care or dental provider. And so we wanted to add a way for you to document when you're helping someone change that sub plan. Um, and so this also will apply to when you help them change the subcontracted dental plan, so the dental care organization. And so they're sort of changing the plan, some kind of subplan within a CCO. And so, Anna, I see, what about when they change CCOs? One example, Trillium to Health Share. That's a really good question. I'm glad you brought that up because that is actually considered a case change. And so if you are helping someone change CCOs altogether, you'll want to make sure that you document that in section 2 um, on, and actually within case change, thank you, Anna, for bringing that up. I'm going to put in the description here that example of changing when you change CCOs, like for example. And so then you would document that here, reporting a change on a case, how many individuals, and then maybe even in this section when you're important information, you could say something like helped client to change CCO, something like that. Um, and does that include switching to open card? Yes, that would. I think I yes, because I or maybe yeah, I'm gonna follow up because I'm the data person and I'm not the expert in health system navigation. But I am fairly confident that the answer is yes, but I will follow up when I send out the link and I will just confirm that. But it's a really, really good question. Thank you for asking that. Um, yeah, I believe I'm like 95% sure, but I want to be 100%. So I will follow up. And so that's where you would document that if they're changing their CCO, um, or probably most likely open if they're switching to open card and you're helping them with that. That then it's documented up here in the application assistance. But anything else like the subplan within the CCO or the subcontracted dental plan that would go in section 4. It's very complicated, but I'm hoping that you're tracking this. But we did want to add that enrollment change because it was missing. Okay. There is another question here I want to respond to. What about when reporting TPL, having the private insurance removed and then assisting with choosing a CCO now? Oof, that is like a very, very good question. I don't think I have any of my other colleagues from, no, I think there's no other OHA colleagues on here. And these are all really good questions. I am going to follow up with this and get that response to you. And when you get the email after this call in a couple of days, it'll have the responses to these questions. Because these are all very good. This one's fairly specific, and I don't know if I have the exact answer. Um, but yes, thank you. Keep them coming though. They will all be answered. And I'm sorry I couldn't answer that one. All right. Um, so there's another change we've made within this section 4, and it should say coordinated care organization navigation. I'm not sure why that word isn't there. I'll put it back wherever it went. But we did move 2 of the CCO navigation services from section 4 to section 6, which is really just focused on assisting OHP members to access healthcare services. So like all those other things that you're doing to help somebody. So that's where we have the billing, scheduling an interpreter, helping them access medications. And so we moved two different services, healthcare or health system navigation services down in this section because we didn't want or I guess these are some services you can provide to someone regardless of them being within a CCO or open card. So these two, the accessing traditional health workers and accessing health related social needs used to be in the CCO navigation section, but really anybody, you can help anyone with these that's in OHP. Whether they're getting it through a CCO or open card. And so we wanted to move it down just to ensure that we're not missing out on when you're providing the service for somebody who's on open card. And um, so the first one, accessing traditional health workers, we did clarify I think it used to say non-traditional healthcare workers, but actually that the preferred and updated term now is traditional health workers, THW. And so we wanted to make sure we had the correct terminology. And then we included who this is, because I think there was some confusion about who is or isn't a traditional healthcare worker. And so we listed these out here like community health workers, doulas, peer specialists, peer wellness specialists, personal health navigators, and then tribal traditional health workers. Um, and then secondly, we added the supporting members to access health-related social needs. And so, you know, health-related social needs is a benefit that folks on open card can also access. So we wanted to move that down here as well. I see another question. What about assisting them to connect with insurance agents to get help with advantage plans with Medicare? Wow, these are like very good, very like deep knowledge questions that I don't have the answer to. But Alma, I promise, along with the other ones, so around the open card, does that include in a case change? And then the other question Anna asked, I will put this in that and get those really specific answers for you. Um, Celia, did you have a question? Or maybe you're just off mute on accident. There you go. Okay, thank you so much.
Sorry, no.
Sorry, Celia, did you have a question? Oh no, you're just coming on and off mute. Sorry about that. Okay, so let's keep moving. Um, And I'm just going to stick with the Smartsheet and show you the changes here. So section 5, I think, is where we're at now, scheduling medical appointments. So the big change here is that we are no longer asking you to tell us how long until you were able to make the appointment. So in the past, you say, yes, I help with an appointment. You say primary care, and then another question would pop up that would say, how much time until they can be seen? And so it'd say like 3 months, 6 months, more than 6 months. And so the reason we removed that is I think although the intention was good with that question, we wanted to know, are we seeing trends in how long people have to wait? Is that telling us something about, their ability to access these appointments? Are we seeing things take longer or shorter? But I think really what we got feedback is that the section's too long, and it's really not related to the work plan deliverables. So it's sort of like a nice to know, but not a need to know. And really, the primary purpose of this activity reporting is for you to report out in the health system navigation services you're providing. And so we wanted to cut the questions out that just weren't necessary. And so those questions around how long does the member need to wait until they can be seen was just one of those that we thought we got some feedback and we all came together and thought, yeah, it's not necessary for us to collect this. And it was sort of inconsistently documented, I think, anyways. It's kind of hard to, yeah, I think it was hard for folks to answer those questions accurately. And so we did remove those from the survey. So now when you select an appointment, it'll just ask you which ones, and then you'll still be able to tell us, whether you attempted to make an appointment but were unable to. And then if so, if you were unable to make the appointment, it'll still ask you kind of the reason here. And we still have the close the loop follow-up option here. So if you were helping to follow up on scheduling a medical appointment, you can click that button at any point. So now the section 5 is just a little bit shorter on scheduling medical appointments. Was there any questions about that at all? All right, great. And so it looks like we've already gone through section 6 and those changes. And so really, so that's it. Those are all the changes that we've made. I might just go through just in summary. Just really briefly. So the section 2, application assistance, we made the number of people, a number of individuals that are included in that case, depending on what you're reporting. So if you're submitting an application or a renewal or a case change, now those questions are required to tell us how many people were included in those services or on those applications. Um, We've changed the qualitative to be very specific that we just want you to document any important information related to that service that you provided. We added 2 topics in the healthcare system navigation education section on health insurance literacy and whether you're talking members through open card and how that works. We've added CCO enrollment changes, service around coordinated care organization navigation. So if you're changing a sub-plan within the CCO, including the subcontracted dental plan, that's where you can document that. We've also removed 2 of the services you might be providing from coordinated care organizations to section 6 so that you can more easily document when you've supported a member who's maybe on open card with these. So it's accessing traditional health workers and accessing health-related social needs. So those are down there now. And then section 5, we just removed the questions related to how long does the member need to wait to be seen. So when you say you've scheduled an appointment, there will be no more follow-ups about how long they need to wait. You'll just be able to say, I scheduled the appointment, and then whether you attempted to make one, but we're unable to, or did follow up closed loop. So we have fewer questions in section 5 now. And that's it. So I'm just going to pause one more time to see if there was any other questions about all of that have come up for you as I've done this summary, and then I'll get into some changes we want to make, some changes we're going to make for the next grant cycle, and then some of the next steps. Alrighty. Don't see any coming up. And I see a hand though. I'm sorry, how long has your hand been up? Oh no. Please feel free to come off mute.
Thanks for all the update. My name is Jenya. I'm from Asian Health and Service Center. One of the questions, actually, I just recently take the health system navigation training, and then one question I asked the facilitator regarding to like what if we help with the urgent care appointment, and the feedback is when we choose that drop down for like there was just a specialty care. There's like
Yeah.
no urgent care. Um, so I just wanted to align and kind of see how if we are helping clients to schedule or like to kind of refer them to urgent care or like help them with that process.
And then when you asked that question during the training, do you know what they said?
Specialty care. Specialty care.
Specialty care. Yep. Okay. Yep. That's what I would say. And that's sort of the guidance I've given before. And so yeah, you're right. That would fall under there. And again, you can use, I mean, if you feel like you want to specify that it was for urgent care, you can give that information in this open-ended um, qualitative part here, but it's optional. But I would put that in this specialty care.
Okay, thank you.
Yeah, good question. I did know the answer to that one, so thank you. Um, all right, I'm just gonna make sure there aren't any other hands that I've missed. I don't think so. Okay. Okay, so we did get a lot of great feedback that we weren't able to implement this time around, but we will be implementing for the next grant cycle. So many of you, you know, are you apply for this grant every time it comes up. There's going to be an opportunity soon or that up to kind of apply for the next round of funding for this. And so that would start basically in a year from now. So it'll be the 2027 to 2029 grant cycle. And so these are some changes that we will implement for that next grant cycle. We got a lot of feedback that the form is repetitive. I think this really comes up especially if you are entering in multiple forms a day and you have that basic information section where you have to put, the same information again and again and again. And so I think completely understand that one and hear that. And so I'm going to bring up the form again and show kind of what the change will be. And so of course, you'll have to still put the date, but then what we will have is a kind of a roster or a list of all of the assisters who are submitting data. And so let's say I'm an assister and I put my name here. I'd be on a list. And in the back end, that list will connect me to what the organization that I'm working with and what the grant is that organization is a part of. And so essentially this question 1.2 and then the 1.3, depending on which one you select, it could be the Healthier Oregon program. But at any rate, these two questions will no longer be on the form, and you won't have to continuously put which grant and then which organization. You won't have to put that because on the back end, it'll be in a list. And so as long as you put your name, um, it'll associate your name with your organization on the back end. And so you just have to put your name and then you move on to the county. And so I know, um, might not seem a lot eliminating just two questions, but I think if you're doing this multiple times a day, not having to enter those two pieces of information is really going to speed things up for you. So that is it'll take a little bit longer to implement that change. And so we wanted to wait on that one until the next grant cycle, but that'll be coming. And so there'll be less buttons and less things you have to push. Um, So another bigger change that we'll be making is I think organizations, many of you have really expressed that you want to be able to edit your own data. So how it works now is if you recall, or you might get this email every month from me where I remind you to review your data, and then you go into the Smartsheet space and then you review it, you download it, then you highlight something and then you send it back to me. So it's a kind of a lot of manual steps back and forth. And we're going to work on a solution for letting you just be able to access and edit your own data. So we don't have that solution yet, but we are actively working on it. And so most likely we'll require you to have a free Smartsheet account where you log in. And so right now there's no logins. You don't really have to mess with that, but in order to edit your data, most likely that'll be a step. But then once we get that set up, yeah, you'll be able to edit your own data, which will just make things a little bit easier. Um, and then just the final piece I wanted to mention is just feeling like, there's a sense that you're reporting too much information, like it feels like a lot. I think it's a hard balance because we want to capture the breadth and depth of all your work, but we also don't want to require you to report more than you have to. And so it's about finding that balance. And so what we're going to be working on for the next grant cycle is really, having more guidance on setting your targets. And so meaning like, the number of encounters that you're wanting to achieve throughout the grant period and really helping to make sure that that target is appropriate given the funding amount and given the number of assisters that are being directly funded by the grant and the amount of time that they're spending. And so really like having a more realistic target. And so hopefully that will help to inform you about how much you should be reporting. And so, say if you have 10 assisters that are working in your organization, but only three of them are being funded by the grant, you know, I think it would be make more sense to not have everybody within your organization reporting, just to have the proportion that's being funded by the grant. So I think more to come on that. There'll be more guidance on that, and so the end result will be really having less less that you're reporting, and you'll have more clear guidance on that. For now, I think yeah, keep doing what you're doing, and you might have an opportunity to or I know we're working with some organizations to do amendments right now, and so this might be coming sooner for some organizations. Um, and so these are some changes that just will take a little bit longer, but we hear you, and we'll keep these at the forefront as we're setting up things up for the next grant cycle. So let's talk briefly about next steps, and then I will just leave it open for any other final questions that you might have for me. And so I will share the recording with you within the next couple of days. We have to get it put on YouTube, I think, and have a link. That's kind of the only way we can share these big files. But it should only take a couple days, and we'll share that link. And then would want you to share that with anyone else in your organization that you think well, I guess anyone else who wasn't able to attend the training but then is using Smartsheet and will need to understand what these updates are. And so you'll be able to share that with them, or you can even go over the changes with them if you feel comfortable. But essentially spending these next 2 weeks trying to get everyone on your team up to speed on the changes. Then June 30th will be the day that I actually update the form. And so you'll be using the current version up until June 30th. And when you log on July 1st, you'll see that the form has been updated. I will be updating it in the evening, so hopefully nobody will be using it then. And so then in July 1st, it'll be live and ready to start using. Okay, well, that's the end of my presentation, and I want to just open it up to see if there's any other questions. If you don't have questions, feel free to drop off and I'll be following up with you with the link to the recording and the answer to some of these questions in the chat as well. So if you have any questions, you can raise your hand, put them in the chat, or feel free to drop off if you don't have questions. Thank you, everyone. Thank you. Thank you. And for those of you still on the call, if you have questions, let me know. Otherwise, feel free to jump off the call.